Welcome back, kids and coaches. And today we're going to finish up with Unit 7 by finishing up here with the elbow, forearm, wrist, and hand. So let's jump right into it. The elbow is pretty simple. With the elbow, the only thing it's supposed to do is to functionally lengthen your arm. Really, that's about it. So when you look at the elbow, all it does is it takes you from here to here. That's the big thing about it. I always jokingly tell my classes, but try to wipe your ass with your arm straight extended and not bending your elbow at all, and see how well that goes. There are a total of 3 bones we have here. You have one in your forearm and two in your forearm, one in your upper arm. So the upper arm bone we have is our humerus, so same as what we had with the shoulder. Then you have your radius and ulna. So those are your forearm bones. If you look at your forearm, everything on the thumb side is going to be your radius. You take your pulse on your thumb side, it's called your radial pulse. Anything that says radius or radial has everything to do with the thumb side of your forearm. The pinky side is your ulna. Now, the radius and ulna form a pivot joint. So they allow you to roll your forearm over. And only the radius is moving. So if you hold on to your arm just like this, and you feel for each bone on the side, and then you twist, you will only feel the thumb side moving. The radius is the one that rolls over. So being a pivot joint, it rolls over it. So a pivot joint would look like this. If I had this bottle cap in the bottle, the one would roll over the side of the other. So it actually would look like that. Okay, so that's just what's happening there when you turn your wrist or turn your palm up and down. It's called pronation and supination. You pronate when you put your palms down. You supinate when you turn your palms up. Think if you're holding soup, you have to hold your soup in the palm of your hand, so you have to have it palm facing up. Really, the only important ligament you should remember is the UCL. Your UCL is your ulnar collateral ligament. Now, you also have an RCL, which is your radial collateral ligament. So remember, radial means thumb side. So your radial collateral ligaments go on the outside of your elbow, connecting your radius to your humerus. Then you have your UCL, which is much more important for us. Your UCL is right here. It's actually a band of 3 ligaments that form kind of a triangle, but it connects your ulna, so pinky side, ulna, to the humerus. If you injure this, this is the ligament that gets injured when you have Tommy John surgery. All of the elbow flexors are real simple. They are B's. You have biceps, brachialis, and brachioradialis. Those are the ones that are going to bend your arm. Everything that bends your arm is a flexor. They all start with the letter B. The only extensor you really have that you really got to worry about is your triceps. So triceps is your primary elbow extensor. Brachialis is actually your primary elbow flexor. So we talked about UCL and RCL sprains. If you have a tear there, bursitis, you can always get that. If you have a dislocation to the elbow, you have done something terribly wrong. That takes an awful lot of work to get that out. You're only going to dislocate your elbow if you really have blunt force trauma to it. It's very difficult because the way your elbow looks is you actually have your ulna, which is a hook, and it hooks into the base of the humerus. So that is locked in tight. To get that to come out, it is extremely difficult and extremely painful. If you have an ulnar nerve injury, you can feel your ulnar nerve if you just press against the middle of your elbow. So if you take from the elbow straight down where your elbow folds right there, if you just rub up and down, you'll feel almost kind of like a pinching sensation, maybe like a tingling sensation that might go all the way down to your pinky. That is your ulnar nerve. Sometimes this can get irritated, and you would definitely know because you would feel it in your pinky and ring finger, but it can move out of place. If it gets displaced, you have to have what's known as an ulnar nerve transposition surgery, where a surgeon will go in, they will take the ulnar nerve and move it back to where it's supposed to be. There's a canal it moves through, and then they just suture it back in place so it stays where it's supposed to go. That's the major issue you would have with that. Now, with the forearm is just really a continuation of the elbow here. So the forearm movements are exclusively pronation, supination. That means the only movement that your forearm does is it turns your wrist over. The major muscles here, pronator teres, pronator quadratus, the supinator muscle, your biceps, and brachioradialis. All three of these, so biceps, brachioradialis, and the supinator, all help turn your palm up. Your pronator muscles turn your palm down. Pretty simple. Mostly you're going to look at like a fracture here. I mean, forearm injuries are not really all that common unless you have like a blunt force trauma. Now, your hand, wrist, fingers. All of your wrist bones are carpal bones. So everything that is your wrist bone is a carpal bone. All of these have names. So all of these here, the exception of that radial styloid process, the ulnar styloid process, those are all your carpal bones. They all have names. Your metacarpal bones and your phalanges are your fingers, and the bones in your palm, those have numbers. So your metacarpal bones are in your palm. The bones that are in the palm are these right here, and these all have numbers. Your first metacarpal bone is your thumb, and it works over. So 1, 2, 3, 4, 5. You name your phalanges or your digits the exact same way. So your fingers are all numbered as well. So again, your thumb is digit 1, index finger is digit 2, middle finger is digit 3, ring finger digit 4, and pinky finger digit 5. Those are all numbered. All of your wrist and forearm muscles are going to have a name that tells you exactly where they are and what they do. All of your wrist muscles say the word carpi on it. If it says carpi, that means it moves the wrist. It does this, so flexing the wrist, extending the wrist, or doing radial or ulnar deviation, waving your hand like that. If it says digit, digit means your fingers. It only moves your fingers. And we're talking about your 4 fingers here, not your thumb, because anything that says pollicis on it means that it's just moving your thumb. If something says ulnaris, it moves the ulna, meaning it goes towards your pinky side. So it moves towards your pinky side. If it says radialis, it moves towards your thumb side or your radial side. And if it says palmar, palmar refers to your palm. So if you have something like, say, flexor carpi radialis, flexor means it bends the wrist. Well, flexor means bends. Carpi means it bends the wrist, and it moves towards the radius or the radialis. So flexor carpi radialis will bend your palm or bend your wrist, and it will move towards your thumb side. So it can do this, and it can do this. If I have flexor digitorum superficialis, this flexor means it bends. Digitorum refers to my digits, so my fingers. And then superficialis just means it's superficial. This is going to bend my fingers. Same exact thing with the extensor muscles. All of your extensor muscles are going to be on the back side of your hand and your forearm. All of your flexor muscles are on the palm side of your hand. all of the extensor muscles are on the back of your hand. All of your extensor muscles are going to take your wrist or your fingers and they are going to move them upward. So if I have, again, a carpi muscle, it's going to extend my wrist. If I have a digit muscle, it's going to extend my fingers. But exact same things apply, exact same rules apply. So for example, extensor carpi radialis. Carpi means wrist, extensor means I'm going to extend my wrist, and then radialis means I'm going to move towards my radius side or radial side or my thumb side. If I have extensor carpi ulnaris, I am going to carpi, that is my wrist, extend my wrist and move it towards my ulna or pinky side. So it'll do that. And then, like I said, same exact thing here. Flexor means it's going to bend the fingers. Extensor means it's going to extend or bring the fingers back. Digitorum refers to the fingers. Pollicis refers to the thumb. Now, getting into the injuries here. Common wrist injuries or tendinitis. You typically have tendinitis on the top of your wrist or kind of in your thumb or like on the side of your thumb here. That's really just caused by overuse. It's something you would see more so as a result of, like, say, typing too much or say writing too much in class, as opposed to, say, doing some sort of injury like on the field. Now, carpal tunnel syndrome, again, this is another overuse injury. So this is going to happen more so from overusing the wrist as opposed to actually injuring it from, like, say, on the field. But this right here is your carpal tunnel. You notice you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 things going through it. Well, if you look at your wrist is pretty small. The carpal tunnel is only about this big. And you got 10 things going through there, including your median nerve, which controls these 3 fingers. So if you want to, well, that's 3 fingers, there we go. So if you want to be able to do this, you've got to make sure this median nerve works. When you get carpal tunnel syndrome, one or more of these things have inflamed. Because it's such a small canal, when something inflames, it causes almost like a domino effect. You get one thing inflaming, it makes it rub on the next thing, which gets that inflamed, rubs on the next thing, and pretty soon you have your whole forearm hurting you. Carpal tunnel, you'll see a lot of times in people that are, say, using like their wrists in repetitive motion. So like people that are typing a lot, people that do a lot of, say, manual labor, so say like contractors, construction workers, carpenters, things like that. The best way to get rid of this is to immobilize the area. You want to actually be in a slight extension, but you also want to not be using this. So you want your wrist in slight extension here, and that'll help take a lot of the stress off of that carpal tunnel, but it just takes a lot of time. A wrist ganglion or a ganglion cyst is just when you have a cyst form deep underneath the muscle. So it's typically on top of your bones. These are perfectly benign, but they can actually be like painful. You can have like potentially like, say, a tendinitis form on that because of how it pushes against some of the tendons or even ligaments in there. To get this out, you really do need to have surgery because it's underneath the muscle. You can't just say drain this. You have to go in and actually eliminate the cyst sac. So when a cyst forms, what happens is that you get typically skin cells that instead of shedding outward, they actually shed inward and they all collect there. And that's what actually forms that cyst. Fractures of the wrist. So you can get a hamate fracture. Your hamate bone is going to be on the pinky side here. Your scaphoid bone is going to be on your thumb side. You're going to get a hamate fracture if you ground a club, like say when you're golfing. So if I'm a right-handed golfer My right hand is my, well, it would normally be my top hand, but it's the one facing closest to the ground. My left hand is closest to me. This would be holding the top of the club. If I ground the club, meaning I hit the club into the ground, the last place that that energy is going to come, so if it hits the ground, it's going to shoot energy up the club back through my hands. Well, the last thing it's going to hit is my wrist of my top hand, because that's the hand holding the end of the club. So if I ground that club, that's where I would get that. You can also see this happen in a baseball swing. So if you get jammed, you'll see that happen occasionally. But usually if you get jammed, like swinging a baseball bat, it's going to affect your top hand's thumb, usually. Now, a scaphoid fracture is going to come when you fall on an outstretched hand. So if you fall and your hand is bent backwards, typically that's where you would get this occurring. Usually, both of these require surgery to put some pins in, because typically the carpal bones or your wrist bones aren't very good at joining back together on their own. This is what's called a non-union fracture. Non-union means they are apart. They're not going to come back together. Boxer's fracture, this happens if you fracture the fourth or the fifth metacarpal bone. So if you punch someone, hence the name boxer's fracture, and you notice if you hit someone with regular trajectory on your punch, you lead with your index, or sorry, your ring finger and your pinky finger. If you have a straight wrist, or even if you have a bent wrist for that matter, and you hit there, you are going to put a lot of force, a lot of impact force going through the knuckle into there, especially if that bends, because now there's nowhere else for that to dissipate. So all that energy goes straight there. So if you hit someone, and I'm not advocating violence, your best bet is to use the hammer fist. If you hit somebody even on the top of the head with a hammer fist, a lot of force there or a lot of area there to dissipate that force. Very hard to hurt yourself if you hammer fist. Puncture wounds, pretty self-explanatory there. The main thing you want to watch out for is if you get a puncture wound that comes from, say, a metal object, because that can potentially lead to tetanus. A mallet or trigger finger. Now, when you have a trigger finger, what happens is your finger gets contracted into looking like you're pulling the trigger of a gun. So if I were pulling the trigger of a gun, I would pull my finger in. Well, a trigger finger is when that happens and it sticks. So your finger is stuck like that. And it's caused because you get usually a nodule, which is a kind of like a cyst or a growth there behind the tendon sheet, which would cause that to happen. So essentially it locks in and gets caught, and then that nodule traps that tendon. So now it can't release. Even if you tried to pull it apart, it would be like you were trying to pull a piece of paper out from under a heavy rock. You're not going to get the paper out without tearing it. So usually with this, you have to go and you have to release this or get that essentially moved or cut out. Very simple procedure, but it is still a somewhat invasive procedure. If you have a boutonniere deficiency, this just means that your finger is bent and then the end of it bends back out. So if you look at the finger here, I have it bent two ways. It's when you get this bend of a different kind, that's when you have this deformity there. And a swan neck deformity is when you have this where you extend this middle joint and then you flex the end joint. It's very difficult even to put your finger in this position, but it would be like pushing this out like that. So see how this extends out, and then bending this in. It's very uncomfortable even to do that. Typically these are happening though if you have rheumatoid arthritis, so not a huge concern for us. I guarantee every single one of you thought that was a middle finger. Now, if you have a jersey finger, this doesn't mean like you're from, New Jersey. A jersey finger refers to if you catch your finger on someone's jersey. This happens a lot in soccer. People will, run by someone and someone will grab their jersey. And if you just even grab, say, a jersey and you feel like how your finger flexes, you can feel a lot of pressure on the underneath side of that second knuckle. And what happens there is that you typically get a tendon rupture and or a bone fracture as well. In a case like this, you could see here, this bone is popped off, but it's because a tendon has pulled it off. So this usually requires surgery, especially to get that tendon back in place and to get the bone to reattach. Gamekeeper's thumb, this is where you get the ulnar collateral ligament of your thumb. So you actually have one here. It's really your metacarpal phalangeal joint in your thumb, but you can actually get a tear there. And again, this usually isn't going to happen a whole lot. Similar instances to where you would see a jersey finger, you'll see a gamekeeper's thumb. And the last one here are finger fractures and finger dislocations. So finger fractures, and again, we're talking about the fingers themselves or even the thumb itself, not the metacarpal bones. So the metacarpal bones will break during a boxer's fracture. Fingers are going to break usually from compression. So you stub your finger, that's usually where you'll break that. If you have an open dislocation, this is usually, and here's what an open dislocation looks like. It's where the bones actually pop out. Now, these bones are a little bit stained from the, not only blood, but usually they'll have like some sort of a disinfectant substance because it looks like he's already at the hospital here. If you ever see a bone pop out, your bones are pearly white. They are whiter than your teeth. So you definitely know when one pops out. But this happens if you hit something with your fingers extended. I've actually seen this happen one time in my life. I was coaching a 13-year-old baseball team, and this was, oh gosh, nearly 15 years ago. One of my players slid into third base head first, caught his thumb on the side of the base. So if the base was this business card, he slid and hit his thumb like this, and it pulled his thumb back as his hand kept going forward, and he popped his thumb out just like that. So how this looks, those are your metacarpal bones. He popped his first one out. And what was kind of funny about it, I mean, we can joke about it now, but when he first got up, like he was all pumped because he was safe. And then he looks at his hand, he's like, man, I think I hurt my hand. And he shows it to his dad, who happens to be the third base coach. No timeout, no nothing. Dad just grabs him and they run. They go out. And then as soon as they got to the parking lot, all I heard was a earth-shattering scream when the adrenaline finally wore off and the kid started being in pain. But yeah, that you're talking about, you have to have surgery to reconstruct that or to get that back in. Needless to say, he was out for the rest of the season, but you do expect a full recovery with something like that. So anyways, that is everything for Unit 7. So you are down to the last week here. So remember to make sure you get in all your assignments for the week. Just real quick, discussion question and your final submission for your paper, all due on Sunday. And then I will see you guys next week.